All right, so I'm going to do my best to condense our year's worth of work into these slides and hopefully bring everybody up to date on what's been going on behind the scenes. As I said, we have Lorna as our new CEO, and she started her position in January. And our strategic plan had actually expired, our original strategic plan, and it didn't make sense to do a new strategic plan until we had a new CEO who could be part of the process. So once Lorna started, we gathered as the board with the staff in February in Orlando and spent several days really trying to hash out where should the Lymphoma Coalition go from here? What should that large strategic framework look like for the next 3 to 5 years? And as many of you know, if you working with your own board, I know I've had this experience myself. It's not always an easy task, but it's really critical to have a good strategic plan and framework so that we're all on the same page, we know where we're going, and we can build projects and programs underneath of that so that we actually meet goals and objectives. So that's what we did, and this is a lovely picture of us in sunny Orlando, but I will tell you this was about a minute out of most of the 2 to 3 days we spent in a room not in the sun. So, and one of our board members who is not here, maybe I can take a moment, especially for the new folks, to, if my fellow wonderful board members can just stand up, just so everybody knows who you are. We're missing two right now. Rosie from Switzerland is not able to join us at this meeting, unfortunately, and Lauren Pretorius will be coming a little bit later, so Sarper, Guy, and Monica. And I really want to thank everybody publicly for the amount of time and energy that everybody spent in putting this all together and making this happen. So Lorna just went over the member feedback and what we've heard from all of you with regards to what you're looking for to get back from the coalition. So we've incorporated all of that as well into our plans. And our original vision statement was a world without lymphomas. And yes, I think that we would all agree that's a really wonderful, wonderful vision. But I think at the end of the day, we really talked about what should the vision of the Lymphoma Coalition be? And we took a lot of time to say, is this really the vision of the Lymphoma Coalition? And can we really fulfill that? Because we don't fund research, we're not in the research arena, so is that really something that we can fulfill? And what we debated and ultimately came up with was equity in lymphoma outcomes across borders, because all of us in the room are working tirelessly every day in our country and our diseases and so forth to make sure that all of the patients receive the care, the support, and the treatments and access to treatments that they need. And it was really an interesting and very deep conversation that we had to say what kind of wording is really important. And we talked a lot about, came up with equity versus equality. And I think it's a really important distinction because, especially in our current situation, it's about having everyone comes to the table, every organization comes to the table from a different place and a different perspective in how we are approaching the service that we're doing. And it's actually equity and not equality, because it's a little bit hard, but I think this is a great visual. If you look at equality, it's getting everybody the same thing, but equity is really leveling the playing field so that for all of the organizations, no matter where you're coming from, what your size, what your services are, we all have the capacity to have equity across the board for lymphoma patients globally. So I hope that makes some sense, but I think it's a really important nuance and a distinction that from the Lymphoma Coalition is really important as we build our vision for the future. And And I will say, I have to also say that the staff did a great job in creating these beautiful slides for me to deliver to you. Taking everything, it's been a lot of work. So, we started with the basics, right? From the vision statement, then looking at the mission. What is the Lymphoma Coalition? What's our mission in forwarding that vision of equity in lymphomas around the world? And this was our previous mission statement. And again, this is what we came up with as a new mission statement because, again, what is from the Lymphoma Coalition? This is all of us together. And what is the coalition really able to accomplish from a mission statement that allows all of our organizations to do the work that we do in a much better way? So this was the new mission statement we came up with, enabling global impact by fostering a lymphoma ecosystem that ensures local change and evidence-based actions. And I think, Georg, to your point and some of the others with regards to data and being able to collect information globally so that we can really begin to support each of your organizations in the important work that you do, whether it's the HTA and being able to get access to new treatments and understanding what's going on in the different countries and where some of the issues and challenges are so that we as the coalition can play a bigger role in helping to support all of you to do that really important work. And it's really an ecosystem, right? It's it's not just patients, it's the regulators, it's the pharmas, we're part of a really big, intricate ecosystem that connects and relies on different pieces and parts. And I think that the focus is really how do we, as the coalition, come together at a global, looking at things at a global level, and then help to support each and every one of you at the local level to really make things happen. And that requires data, that requires communications, that requires information. Whether, again, it's looking at how do we pull together resources and materials that can then be used and translated individually. I think those are all the things that you have told us and that we've tried to capture in creating a new vision and mission statement. So global versus local, and that's the balance, right? Looking at things at a global level, but it's got to be executed at the local level. And it has to be evidence-based. We have to have data. I know in my world, it's become so important. We can bring anecdotal information to the table, and we can bring patients to the table to share their experience. But what really moves the needle forward in so many ways, particularly when you're talking to regulators and those folks that are looking at reimbursement for new drugs and things, is what's the data saying? We've got to have data. We've got to have facts and figures that go along with the patient stories and the anecdotes. So our values, we decided, really haven't changed. This is the same as it's always been, and I think it's really still very relevant that our values are that we're impactful, we have integrity, we're credible, we're global and local, we're collaborative, and we're principled. And again, Lorna spoke a little bit about our audiences, and because we are a coalition of member organizations who are doing the work in country or within a disease, our main focus is you, our member organizations. And then, obviously, healthcare professionals, policymakers, industry, and media are also a focus of the coalition, but really it's our members first. And then how do we then supplement in those other audiences? And obviously the patients, who all of you and all of us serve, are the main focus. But for the coalition, our main focus is you, the members, who then are in service to the patients in your area. If sort of as the outlier is the general public. And I think that through all the member organizations, we end up reaching beyond our current patient communities out to the general public. But again, our main focus as the Lymphoma Coalition is all of you. And our initial discussion really resulted in these 4 kind of pillars to focus on. And if you notice, the advocacy and the information, is really that's the action items. How do we do this? What do we do? What are the projects we're going to undertake, right? Advocacy and information, how do we do that? And then the thought leadership and collaboration are really the foundational pieces, right? How do we create the Lymphoma Coalition to be really the world's thought leader in lymphoma, where the regulators, the industry, all of the people are coming to the coalition as their source from the patients. And then obviously collaboration. We can't do anything without collaborating amongst ourselves and amongst our whole ecosystem. And then our strategic direction in everything we do, obviously, we have to be in touch and engage in the market. We have to measure what we're doing, right? We have to be able to know and understand, are we actually meeting the goals and objectives that we've set? And I think that's a big challenge. It's a challenge I know for me and my organization. I think it's something that is challenging, because you always think about measurements as far as data, and that's really important. You've got facts and figures and structures and goals, but I think in our world there's a lot of intangible things that also are very, very important to find a way to measure. And so I think that will all be a work in progress, and certainly open to any insights or things that you all have done that have been successful in order to show how your organizations are moving forward and being successful. And then of course to evaluate, and I think that's one of the things that was really wonderful about doing the phone calls with all the member organizations, is really understanding what everyone is interested in, how the Lymphoma Coalition can best support each and every one of our organizations, and how do we continue to innovate and grow. It's all about being able to evaluate how we're doing, and based upon your input and what you think is important and how we can best help you. And that's an ongoing process. I mean, nothing is ever perfect, and I'm not sure about you in your world, but I know all of this is always a work in progress, and we can always do better. And that's what we're hoping to be able to do as well. So where did we end up with all these discussions and our high-level goals? And then, again, this is the big strategic framework that we're sharing with you. And then know that underneath of all of this are all the details and the budgets and the action plans and how all this actually gets accomplished, and the measurements, and then how do we come back in a year and say, well, what have we done and how have we measured it, and how are we being successful, and then what do we need to change, what didn't work, and how do we do it better? And that is all, we all welcome your input as well. So I know this is a very busy slide, and you will get copies of everything, so don't worry, you don't have to really be able to read and understand this, but and hopefully you did this, yes. So we're really going to talk about the top line here, because that's the big general goals. But understand that underneath, we have to have financial stability. We have to have an infrastructure and a staff that has skills and talents in order to be able to actually do the work, right? We have to be able to support all of that. And we have to have processes in place. So I'm sure all of you know in your own organizations, we need those kinds of pillars in order to actually be able to do the work. But here at the high level, to be exact, are the things that we really want to do to move forward with the coalition, and to ensure our impact, to accelerate the uptake of policy, whatever that is, right, at the global level, and then to help support it at the local level, to facilitate knowledge into action. So again, how do we, as the coalition, pull together what's happening around the world, and then to help all of our member organizations take that information, that data, and how are you able to use that and have an impact in your own country or your own disease state? And then, to translate research into practice. What do you do with all this great science? How do we educate? How do we help you educate your patient community? And with, I think, the acceleration of science and research, I know in my experience, our patients some people are very knowledgeable, but they still don't fully see the whole picture. So how do we then translate that science into layperson's terms so people can understand, and to help them make the best decision in their own individual world, and what role do we play at the Lymphoma Coalition to help you do that? And to develop member advocates to act locally. And I think, Georg, this goes back to you, right? How can the coalition help you train and educate your patient population so that they can become advocates on behalf of other lymphoma patients in your country? And we know more and more that everyone's talking about, oh, the patient voice, bring the patient perspective. That's a really great phrase. But how do you really do that? And what kind of patients, what kind of knowledge is needed to really make an impact? And I think that's a really important role that the coalition can play to help all of us to become better educated. And how do we then be able to plug in our patients to become educated to play a much more impactful role in that whole ecosystem? And then, gosh, I need my glasses. This is really bad. That's what happens with age. And then influencing global and regional policies to, again, increase success locally. So I think it's all about trying to understand globally what's going on, what kinds of things need to happen at the local level, and then how does the coalition provide support, education, tools, and a variety of things so that we can all become better at what we do and more successful. And then how do we then share that at the global level? And how do we have an impact on moving the needle forward for all patients with lymphoma globally? So our strategic objectives, obviously, for information and translating the research into practice. And I think this is such a big key. This is a huge project. Obviously, none of these things will happen overnight. There's a lot of work that's required to have this go on, and it really is understanding what's happening around the globe and what specific things we need to do in order to be able to do this. And I think the team has really been doing a great job in trying to pull some of these things together with the subtype reports and the outcomes from the global survey. And there's so much more that we can do, and how do we share this data locally in our own organizations and in our own countries, again, facilitating that knowledge into action. And what role that the Lymphoma Coalition can play, again, at that global level in taking positions and putting statements together so that then we can leverage that, and we're not, as individual organizations, kind of out there on our own saying, this is important. We've got the backing of the coalition, which again is 82 member organizations around the globe. That's a big deal. So how do we actually do that is really important. And then obviously on advocacy, what's happening at the local level. And I think if anyone talks to Maya about her experience and how she really was able to make a difference in Serbia and what she was able to accomplish is amazing. And how can we do more of those things, especially with regards to the new drugs that are coming down? How do we get people in clinical trials? And then if the clinical trials are successful, how do we make sure that those treatments are available and in every country for every patient and everyone can afford them? And that's a big goal, but how do we do that and how do we facilitate that? And then supporting all of you to do that locally. And I think that's a big challenge. I know, at least in my organization, I'm the scientific officer. I'm wearing multiple hats. And how do we, it's really hard, right, then to translate that into action. So hopefully we'll be able to do more from the coalition to support everybody in doing that and accelerate the uptake of policy. This is a really great cartoon, and we're really excited about the research, but we don't have the time to read the paper, so we'd like you to summarize your findings with one of these emojis, right? So there's so much data out there. What the heck do you do? I know I try to read, I try to stay up to date with things, but holy moly, it's really challenging. So I think the coalition really can help to pull together, and we've been doing that, but I think that we can really take it to the next level and try to figure out, what's that landscape of data and information? How do we put it into chunks that are understandable and usable, and then how do we make sure that it can actually be used individually and in each of the countries? So these are all the keys to our success. Obviously, you need to have money to make the world go round. We need to have financial stability in order to make sure that we can deliver on all of our promises. Good governance and operations, and we've been working on that as the board and my wonderful fellow board members. We've still got some more work to do, I think, to really be able to take the coalition to the next level in its own maturity. And use technology well. And I'm guessing that there are those in the room that have been around for a while that may have some opinions on how we could do that better, and we've got projects underway to look at that and how do we leverage it, make it easier for everybody to use, to leverage technology. And then who are the right partners? Obviously, no group, not even a coalition of this size, can do it alone. We need to partner. We need to collaborate. And we need to collaborate and partner in our whole ecosystem, whether that's with regulators, with governments, with the industry, with the clinical community. And of course, we're all in this together, because otherwise why would we be part of a coalition? So it's really all about all of us collaborating and connecting together. So that's, in a nutshell, what we've been doing for the last year. I hope open to any questions. I'll try to answer them, and then do our best. And obviously, we're all here to answer in detail questions during the next day and 2 days if you have anything that you want to talk about, and open to any suggestions, information. And that, I'm going to stop talking.